And last but not least, I'm just going to go ahead and go over the diagnostics and labs. In order to better understand and evaluate someone who's suffering from kidney disease, again, as I mentioned in the incidents and reports, not a lot of people know that they have some kind of kidney disease. There's many people with hypertension, they have no idea. Diabetes, especially, have a lot of kidney disease. So, aside from getting history or understanding or maybe checking people, they're gonna have to do a lot of screening. They're gonna have to check their risk factors, again, their history, signs and symptoms, what's causing them, what's going on, are they urinating the same or not, and of course, many tests to determine. Some of the main tests usually you will be determined will be serum creatinine, the urea, nitrogen, and then these are to detect the concentrations of them. And of course, usually a very high will mean chronic renal failure. They'll check protein, measurements of protein level, especially albumin. They'll also use a urine sediment examination, ultrasound, CT, and X-ray films. And what they'll show small kidney, as well as renal biopsy. And the renal biopsy will confirm that diagnosis of the acute renal failure. Overall, it's hard to determine sometimes, because not that it's hard to determine, but it's hard to tell when someone does have an acute kidney injury or renal failure, because it's a silent disease until the very end. Again, like I mentioned, in the incidence reports, most people wait till the end, and that's why emergency rates are much higher, because they're not going. All these tests are available, but people aren't aware. So it's very important that we as healthcare workers, start talking to people, making sure that if they have diabetes, if there's hypertension, if there's anything like that, then, have them go check themselves before anything can get worse. Have them tell us if something changes or anything like that. Overall, more than anything, I think prevention is key. And I know diagnostics and labs is very important, but if they're not aware of this, then we can't save them. And yeah, we can diagnose them eventually and get all the information, but that's all the way to the end. So I think more than anything, let's let people know, like, hey, you have diabetes, hey, you have hypertension, hey, you have this, or sepsis, anything that can occur. We have to watch their kidneys. We have to make sure they're drinking water. We have to make sure they are aware of any changes, and overall, we can possibly save more people and avoid so much kidney problems, which has increased in many years over the years. Overall, that's it. If you have questions from us, please let me know, or if I missed anything, I would really appreciate it if you guys add on there. Thank you.